right. Okay, good morning, everyone. Thank you for joining us today for this event. My name is John Frassinelli. I am the Division Director here at the State Department of Education in the areas of school health, child nutrition, and family services. I want to welcome you here as we roll out our back-to-school health and safety guidance for the coming school year 22-23. Last month, the State Department of Education, the Department of Public Health, and the Office of Early Childhood convened a summit of these partner agencies as well as experts, and together we considered plans for school and child care guidance for the coming school year. The guidance that we are releasing today, Launching into Healthy Learning, is a result of what we've learned over the past 2.5 years and from numerous education stakeholders and state agency partners working together for the best ways for school and child care leaders to have the tools to make decisions to keep their facilities open safely. Keeping students and children learning and interacting together, as we know, in-person learning and socialization are the best way for students and children to thrive and to be successful. You will hear one common theme this morning across government and across many of our education partners assembled here today, that together we are committed. We're committed to keeping everyone, our teachers, our staff, our caregivers, and especially our students, safe and healthy this school year, accelerating learning and growing everywhere that children gather, in childcare, in the classroom, in extracurricular activities, and in our entire school community. Thank you again for coming here today. I now have the pleasure of introducing our first speaker, Commissioner Manisha Jatani, the Commissioner of Public Health.
Good morning. Thank you, everybody. And it is a great day to all be together to showcase, as Commissioner Russell Tucker says, our best-in-class collaboration between the Office of Early Childhood, Department of Public Health, State Department of Education, all the other organizations in our state that keep our children active, engaged, learning, physically active, emotionally healthy, and keeping them in the classroom. The work that our educators do every day is going to help us combat behavioral health challenges that we've had and so many other challenges that our children have had over the last couple of years having to deal with COVID. What we're here to talk about today is how we can move forward in this pandemic, recognizing the challenges that we have, but taking advantage of all the tools that we have in our toolbox to be able to keep children in the classroom learning where they learn best. So you've heard many of us talk about over the last several months, schools were able to do this effectively in the months of March, April, May, and June. This is how we ended the school year. So for many schools, they already have been doing this for 4 months in the last school year. But we do have some additional tools this time around, which is that every single school-age child is eligible for a vaccine. If you are a parent and you have not vaccinated your child yet, please take this opportunity to get them vaccinated. It is going to be the #1 way that we can keep children in school and prevent further outbreaks in school districts and in classrooms. We have so many other tools at our disposal. We know that DPH has vaccine vans that we will be partnering with school districts across the state to get our vans out there, particularly with our 36 Alliance school districts. And we want to make it easy. It has been easy for a while, but sometimes it's a reminder that we can be there and be a help to those of you who want easy access to this vaccine. Some of you may be wondering what's different this time around. What's different than what we've been doing? In the spring, the CDC unveiled the COVID community levels. People have been used to hearing about test positivity. This is much less important for us as we are moving into this next phase of this pandemic. It certainly is a marker for us in terms of the amount of disease we've got in the community. It does not capture self-test kits results, but that's okay. It still gives us a marker that we may have more disease that is present. However, The thing that is going to really strap our healthcare system is staffing in healthcare facilities and the number of patients that are in our hospital. And so when you look at the COVID community levels, there are 3 colors. There's green, yellow, and orange. And when you hit orange, that's when we get concerned on whether staffing in our healthcare systems are going to be challenged. Unfortunately, we had one county, New Haven County, this past week that hit that orange mark. And that happened just this past Thursday. We will be monitoring this closely. We will be sending notices out. There is a website available through the CDC that gives us those markers. That does not tell us that we've already hit a point of critical nature, but it gives us a sense that we don't want to get there. So right now we are recommending indoor mask use in New Haven County, and we will continue to evaluate this for every county that we look at going forward. Schools will have these tools at their disposal, but one of the other major things that we are also telling schools is we recognize kids need to be in the classroom. And when we go into the winter season, we know that there are lots of other respiratory viruses that transmit. Flu is another preventable one with vaccination. That'll come up later in the fall season. But one of the things that we are also looking to offer to school districts, they can choose to adopt this policy or not, is one that's called Test, Mask, and Go. The idea with this is that many of our children are going to have runny noses, other cold-like symptoms through the winter, and then going into the spring, many kids have allergies and have similar type symptoms. We as a state are going to have self-test kits that we can provide to school districts and families. And if your child has these mild type of symptoms, not a fever, if you have a fever, you stay home. 100 or more, or you feel feverish, you stay home. But if you have mild respiratory symptoms, we are encouraging schools to consider the policy of testing your child. If they're negative, consider putting a mask on and go to school, because being in school is what is going to be most important. If anything we've learned in public health from our education colleagues is that the number of days lost from school and how that tracks with advancement of kids in our schools in Connecticut is so critical to their well-being, to their nature, to their ability to learn and progress in life. Many have lost a lot in the last couple of years. We want to help them be able to move forward. So thank you to all of you for being here with us. Thank you to our legislative partners, to our colleagues in other departments and in our schools. And I know that with this guidance, we are going to be able to get our school year off to a strong start and make it through this school year with our children happy and healthy in schools. So thank you.
Thank you, Commissioner. And now we'd like to hear from our partners at the Office of Early Childhood. I'd like to welcome to the podium Deb Fliss.
Thank you, John. Good morning, everyone. I'm Deb Fliss, Division Director for Early Care and Education at the Office of Early Childhood, here on behalf of Commissioner Bai. As you all know, child care is a year-round endeavor, supporting children and families, but September marks a time of return from summer activities and the excitement of the new school year. The Governor's Launching into Healthy Learning initiative is well-timed and welcomed by child care providers who have remained open throughout the pandemic, and they have successfully managed the health and safety challenges presented by COVID. The guidance being released today helps providers to make informed decisions appropriate to their program and their community. It also lessens confusion for families who may have children attending both child care and school. The guidance aligns with practices that are familiar to providers and helps them recognize when increased prevention strategies are necessary. As you've heard already, the partnership between DPH, SDE, and OEC has over the past 2 years and continues today to keep childcare safe and healthy for young children. We're grateful for the collaboration and for the product that it has yielded today. Thank you.
Thank you, Deb. It's now my pleasure to introduce our Commissioner of the Department of Education, Commissioner Charlene Russell Tucker.
Thank you, John. And good morning, everyone. Like all our partners here, I'm really excited for the day and the fact that we can put guidance out now so our superintendents and our school communities can prepare adequately. As Commissioner Jatani said, and for those of you that have been around to hear me speak, recently I always talk about our best-in-class collaboration. And I don't say that because those words kind of flow together very nicely, but because it truly is accurate. What you see here really are our partners who partner with us and that they provide us critical feedback. And one thing that we've relied on since March of 2020 is this level of collaboration, open dialogue between our sister state agencies and all our partners to hear from those who will be implementing policy so they can tell us what it is we need to keep in mind as we plan and deploy those policies. So we have weathered some COVID storms and other kinds of things, just keeping our kids in school, where, as the Commissioner said, and I am just so thrilled to hear our Health Commissioner speak in the way she has about education, because it is all of us working together. And we've been able to do that. The one constant construct that's helped us to do this and to keep kids learning in person, despite all those challenges, is because we worked together. We made policy shifts when necessary, and we supported our educators. We supported our superintendents, always there for them. Some of you may have known every Tuesday we had a Health and Safety Tuesday call with our superintendents, school nurses, school medical advisors, local health directors, all of us together, really talking about what's happening on the ground so our policies in turn could be responsive to the things that are going on. So I'm so thrilled about the policy, the guidance that we're pulling out today. And it also allows families to have action steps that they can take in order to make decisions about kids going to school. That is so critically important. We've learned from everything we know that being in person with our educators, with our school staff, and with peers is the best place for our students to be. So we're thrilled that the guidance today will allow that to happen. And we're not done, right? We don't have the crystal ball yet in terms of what's going to happen in the months ahead, but we have a good idea based on what has happened in the past. We want everyone to be prepared. So if we need to make shifts, we can certainly do that. But I'm so thrilled to be able to be here with our partners because we do spend that time together to say, here's the guidance, provide us your feedback, and we can go back and make that work. This is all about all our kids being there, all our educators being safe in the classroom and energized for the year. So I'm so grateful for the partnership here for all our stakeholders, and for those who are watching to know we are in this together. And on behalf of our 500,000 plus students and our 100 plus staff, thank you to all of you for all you've done so we can launch into a new year where our kids are healthy and safe, our staff are safe and comfortable, and our kids can be accelerated in their learning. Thank you very much.
Thank you, Commissioner. And if we've learned nothing during the pandemic, we've learned the value of partnerships, which is why you see so many organizations represented here on the stage, not to make decisions without the folks who are having to live with those decisions. So with that, I would like to bring up the Executive Director of the Connecticut Association of Public School Superintendents, Fran Rabinowitz.
Good morning, everyone. As I step to this podium, I'm remembering stepping to this podium at the Governor's Mansion 2.5 years ago to announce the closing of all schools. And I am thinking about the journey since then, the 2.5-year journey with our partners and the challenges that we have overcome to get to this day. And I thank the educators and the Department of Public Health, the Department of Education, because this is August of 2022, and we are preparing for a return to school joyfully. We are working on the whole idea of teaching and learning our children and accepting them back into our schools with excitement. And certainly never far from any superintendent's mind or any of our partners' mind are the safety precautions we have to take. But what I love about these guidelines is they're streamlined, and they are going to allow us to have as many of our children in school as possible with their effective, wonderful teachers so that we can have a school year that is filled with joy and excitement for that new kindergarten child coming through or for that 12th grader. So I'm very grateful to all of the collaboration that has happened over the last 2.5 years and way before that, and look forward to continued collaboration and to the excitement of our children on the first day of school. Thank you.
Thank you, Fran. And of course, learning doesn't happen without teachers, so we're especially excited to have our education associations with us today representing teachers. So with that, I'd like to bring up Kate Diaz from the Connecticut Education Association.
Thank you. So it's a little bit contrary for a teacher to have a back-to-school celebration on August 2nd. Because my people are not in that yet. They're hopefully still on vacation scouring the Staples 1-cent pencil sale. But I will say that I am kind of reflective of 2 years ago when I had to go back into the classroom, having kind of come off of the, okay, we're all going to teach at home and see how that goes. And the amount of anxiousness I felt walking back into my classroom 2 years ago was really overwhelming. I remember looking at all of the seats in the room and thinking, if I have 26 kids in this room, what's that gonna feel like? You know, we had been quarantined and keeping to ourselves and 6 feet and all of that. So I kind of look at this school year and think, wow, we've come a long way. We are really looking at going back into the classroom with a mindset of flexibility, of understanding, of recognizing kind of where are the points of flexibility we have to have? Where are the points that we have to be concerned about? We're very intellectual about approaching our school year in that way. We look at those factors, those indicators like Commissioner Jatani spoke to, and we look at those as benchmarks, points that we need to shift our decision making. And we look to working with our partners at our district level about making good decisions, decisions that keep us in school but do so safely. What I'm happy to see is how many of our districts are having those conversations with our leaders, our teacher leaders, our paraprofessional leaders, our school nurses. There's a lot of conversation going on. If we've learned nothing in the last 2 years, we've learned that you will not keep the school doors open without working together. We need our parents to do their part, being mindful, testing their students, being aware of what they're doing on the weekends, being conscious of how that might lead into the school day. We need our school administrators to support the decision making. We need our teachers to be mindful and watching kind of what's the dynamics in our school building and are we having all of our needs met? And so I think as we enter this school year, it's not with the same level of anxiousness. Are we aware and still concerned about some of our indoor air quality issues? Absolutely. Are we anxious a little bit about school staffing? Absolutely. But do we have the same sort of panic about COVID? I don't think so. I think we're concerned, but we're mindful. And I think that's the appropriate way to be attacking this disease at this point in time. It's not going away. We've learned that. It mutates, that little bugger. And it gets ahead of us. But what we've learned how to do is to be flexible. And I think that's the most important thing we can continue to execute in this coming school year. Continuing to talk, be flexible, think proactively, and engage with our partners. If you don't do that, you're probably going to fail. But thankfully, Connecticut is doing all the right things. And so I'm proud to be a part of this work. I'm proud to be up here working with these individuals to ensure schools open successfully, our students have a wonderful experience, and our teachers and staff are completely safe in executing their duties, because we're excited to be doing that, although not yet. We have a few more weeks of vacation. So, but thank you very much. We look forward to the continued work together.
Additionally, obviously, our local boards of education have a lot to say and a lot of decisions to make around local policy. The Connecticut Association of Boards of Education represents them well and helps them and guides them in those decisions. So with that, I'd like to bring up the representative from CABE, Leonard Lockhart.
Good morning, everyone. On behalf of the Connecticut Association Boards of Education, I'm here to represent our president, Ms. Elizabeth Brown, as well as our board of directors, as well as our executive director, Ms. Patrice McCarthy, as well as her dedicated staff. My name is Leonard Lockhart, and I humbly serve as the first vice president of CABE. We appreciate the continuing partnership between the State Department of Education as well as the State Department of Public Health, working with our local school districts to keep our students and staff safe and healthy, and to maximize the opportunity for in-person learning. That's quite important to us. This is why CABE honored the partnership with the State Department of Education and the Department of Public Health with our Friends of Public Education Award in 2021. We know that our school board members, superintendents, principals, teachers, and support staff are committed to working with families and students to have a healthy, safe, and robust learning experience. We are excited to welcome everyone back for the new school year, but more importantly, our children are our most important and precious resource, and we are here to serve them as well as working with the parents and guardians that support those children, because we are working for them. So all the decisions that we're making here today is definitely with partnership in mind with parents and students. Thank you.
Also here today, a huge partner in the work that's been happening over the last couple of years is the American Federation of Teachers, representing our teaching professionals. So with that, I'd like to bring up Jan Hockendahl to the podium.
Thank you. As John said, my name is Jan Hockendahl. I'm the president of AFT Connecticut, and I was also a teacher. And I was just thinking that just about this time, I would have two thoughts in my head as a teacher. One, boy, this summer goes really fast. And the second was, boy, I really need to start looking towards next year. And so we would get out our lesson plans, and we would review them and look at our notes from last year, and we would do our research and modify and improve them for the students this year. And you really got excited about the new school year coming up. But we all know the last 2 Augusts, that wasn't what happened. They were really difficult, and our routines changed. We had no idea if we were going to start the school year in person. We didn't know what it was going to be like. And instead of looking forward to the new school years, as Kate said, we were filled with anxiety, apprehension, and fear. Fear of getting sick, fear of not being able to get those students up to where they needed to be because of the trauma that they went through, fear of having to go back to dual or hybrid instruction, because we all know that that wasn't what was best for our students, educationally, emotionally, or socially. And so this August, there's some of that fear, but we're really looking at a new normal, and we're really trying to move forward. And everyone understands that there may be outbreaks as new variants come along, but everyone, from our school boards to our administrators, to our teachers and parents, and especially the students, they really are just looking for some certainty. And unfortunately, we can't give them that certainty yet. But what we can give them is the new guidelines that have been developed so that the districts can collaborate and find ways to meet their situation and their needs. And as the districts that were most successful over the past 30 months can tell you, that's what worked, collaboration. And at a state level, the commissioners that we have behind us really modeled that collaboration, especially Commissioner Russell Tucker. She has regular meetings with our educator stakeholders, including the unions, to discuss how to best educate students in these difficult situations. We may not always agree, but we trust each other that we're all working towards the same goal. We listen to each other, and we figure a way forward, just like we did with these guidelines. And we hope school districts will follow that same model. Superintendents, administrators, teachers, paraeducators, and nurses, the whole school community needs to work together to understand how to stay healthy, maximize in-person learning, and understand the mitigation strategies. And I'm hopeful that this school year will reflect the lessons that we've learned over the past 2 years, that we do our best when we work together. And I urge every school leader to follow the example of the commissioners and set a collaborative, honest, respectful process that leads to good decisions. We really hope that we all have a great new school year and a healthy new school year. Thank you.
Thank you, Jan. We also know that enrichment activities, extracurricular activities, including athletics, are a big part of the student experience, as are the school building managers, your principals and assistant principals working in schools, running those buildings every day. Representing the Connecticut Association of School and the Connecticut Interscholastic Athletic Conference, I'd like to bring up Glenn Lungery.
Thank you, John. It's with energy and awareness that our principals across the state are preparing for the new school year. As has been mentioned before, it certainly has been a challenging couple of years, but we've had outstanding leadership and are very grateful for Commissioner Jatani and Commissioner Russell Tucker for the work that they've put in with us over the last couple of years to ensure we were prepared to give our kids the best opportunity we could within the classroom and extracurricular activities. As our principals prepare for the new year, we're really excited about coming back to somewhat of a normal start to the year. We have the information that we need well in advance, as evidenced by today's work and giving us the guidelines that we need to prepare for the year. And we're also focused on continuing to re-engage kids. And a big part of that is going to be the extracurricular opportunities that we have with our students. The thousands of kids that participate in band and theater, and the 70,000 plus kids that participate in high school interscholastic athletics throughout the year. So with that, we enter this year with awareness of COVID, with awareness of how to treat this and how to keep our kids engaged in the classroom and in their extended curricular activities, and are grateful for the opportunity to come back and give them all the opportunities that they deserve this year. Thank you, and thank you to Commissioner Russell Tucker and Jatani for your work.
Thank you, Glenn. And finally, we want to honor our legislative partners. A big part of the work that happens in schools is a result of legislative policy. Here this morning we have Senator Huang, who's a big champion for both children and public health and education. So I'd like to bring Senator Huang up to the podium.
Thank you. Good morning, and I'm so grateful to be here because I'm in the presence of people who make our lives better, our children safe, and educate them. It is truly a collaborative team. I'm here on behalf of the ranking member in the public health, but I want to acknowledge the commissioners for your tireless effort and constant communications for the past 2.5 years. I also want to be able to share that as a legislative branch, we bring all the shareholders and different perspectives to this dialogue and conversation. Parents and the supporting community is what we do in the legislative branch to bring a voice to this conversation. So it's a tremendous group behind me, but equally important is the broader community, parents, as well as individuals whose lives are impacted and place such a focus on education. So we all need to work together as a team, and I'm grateful and thankful for the tremendous team that we have in the state of Connecticut. So thank you very, very much.
Thank you, Senator. That concludes the speaking portion of the event this morning. We will now take questions on topic. If you don't mind naming who you'd like the question to go to, we can start there.
I have a question just for the health commissioner. Just wanted to provide a little more specifics on the test, mask, go optional strategy, and essentially what does it mean for all schools? Because I know it's an optional, more of a recommended plan, but what happens, say, a student or a parent comes in and the kid's not masked despite displaying mild symptoms?
So, you know, every school has been dealing with this type of thing for the last several years, actually, quite frankly, right? And so many of our school districts and school nurses working with the teams that are in a given building have had to deal with these types of issues. That is part of education. You have a child who's not that well. What are you going to do? Our suggestion with this strategy is that up until now, we've been saying, if you have any symptoms, stay home. Because the impact of COVID was so significant, and because of the range of symptoms that people could present with, that we had to do that. But what we've learned over these last couple of years is that we now have the trifecta when it comes to an infectious disease. We have diagnosis set, we have treatment set, and we have prevention. We know the 3 ways to manage COVID. So once you have that, you have to think about all the other things that we've been talking about: emotional, physical, intellectual well-being of our children, behavioral health. What are all the things that we're seeing that have happened over the last several years? So with all of that in mind, and if you take the impact of public health more broadly and how it is affecting our community, the suggestion with this strategy is that if you have one of those mild symptoms, where before we would say, well, you got a mild cold and you're doing okay, just send your kid to school. And we now have ended up in a policy where kids have been out of school for so many days because of that. What we're saying is we're going to help provide you with the tests. And test your kid every day if they've got those symptoms for multiple days. And we will provide the schools with tests to be able to do that. The masking is not a mandate. It's nothing like what we've been through, but it's an additional prevention strategy. When I talk about the trifecta of diagnosis, management, and prevention, we know that vaccines are preventative, we know that masking is preventative, and not everybody's going to do everything, and schools will have to deal with those decision-making steps that come their way. So this is not going to be any sort of, you must adhere to this policy. It's a set of tools to be able to give a school to say, you know what, we understand that children need to be in school, and this is another way that we can help try to maximize the number of in-school days for any given child.
And when are you recommending that a child comes back to school after those guidelines?
So the COVID guidelines on if they test positive have not changed. So that is the recommendation of the CDC. We continue to monitor the CDC in terms of when can your child go back. We have included a calculator that the CDC has on a website to make it easy for families, for school nurses. If you test positive, that is day 0. Then you've got your 5 days that you're home. And I understand it's a challenge. Many children might have mild symptoms for a couple of days and then they're better. But that's the guidance right now if you test positive. What we're talking about is more the kids that do not test positive but have something else. And I'll take this opportunity to say, you know, we are encouraging boosters going into this school year. We also know that there may be new boosters that come out, continue to monitor for that. But we think at this point that for children, those new boosters may be unlikely to be available. Those new boosters may be more likely to be prioritized for adults and particularly, you know, older people. That's probably going to be the first place, but we don't know that yet. We're still waiting. This is always a game that is changing in real time. But we have certain things right now that we can do. And we want to start the school year off strong and with the tools we have now, and we will modify as we can. So if those guidelines for how long you need to isolate after testing positive for COVID change over the course of this year, we most certainly will be adopting that. But as of now, the 5 days of isolation still remain.
Because people hear masks and now they freak out. What are you saying specifically about New Haven County today? It's in the orange, and therefore you're recommending that school boards put mask mandates in?
We are not recommending anything in terms of what school boards do. What we are doing is saying that at the New Haven County level, this would be for anybody in an indoor setting, we are recommending masking indoors, in any indoor setting. That is the public health guidance. Now, what I will say is, why is that the public health guidance? Another story and narrative that everybody has heard about are the healthcare heroes that started out this journey 2.5 years ago. Many of them have left the workforce. And we have healthcare institutions that are dealing with staffing and workforce challenges. As a state, we are doing all that we can to bolster that workforce. But the reason for a recommendation for indoor masking in areas that turn orange is think about your fellow citizen. Think about those healthcare workers that you know in your life. I'm pretty sure everybody knows some healthcare worker and the work that they've been doing in hospital settings and clinic settings for the last several years. And I'm sure many people know people that have left healthcare over the last couple of years. So with that in mind, the recommendation for anybody who is in an Orange County indoors is to mask.
How often will the vaccine clinics be offered at the Alliance districts? And will they be offered every day, after the day, on the weekend?
So that is something that's a work in progress. We're partnering with each of the school districts to see what works for them and what's going to work for their communities. But we are available as the Department of Public Health. We collaborate with our SDE colleagues to be able to help bolster those partnerships and make ourselves as available as possible to those districts. And again, local health departments are providing clinics. You can get a shot at almost any pharmacy. Pediatricians' offices are offering vaccines, so there are multiple different ways that you can get a vaccine.
And with schools, I want to say my schools we're having the option to offer remote learning this year. How do you recommend them going about that? Like when an appropriate time for remote learning would be?
Can I defer to Commissioner Russell Tucker on that?
So literally, we've got guidance about remote learning that is providing the direction for districts that are choosing to implement the legislatively allowed remote learning for high schools. That we have guidance that we've placed out there. We've worked with our Remote Learning Commission to develop those guidance, and it's there for them to utilize.
Sort of related to that, is there ever a time when you get like high transmission where it would make sense, since hybrid learning is no longer allowed, to go to remote learning for a class? Would that be an option if, say, you got 13 out of 20 students that are all sick with COVID at once? What happens then?
Yeah, so one of the things that we're continuing to do is to make sure that cases are still reported to the Department of Public Health, and we will use that information to help guide districts if that's happening and they need to, stop the spread in a particular classroom. Then we'll have that case-by-case conversation with them as we get to that point.
Okay, I want to thank our panelists and our partners for being here today. I want to thank all of you who came for this press event today. We really appreciate it, and that concludes our event for today. Thank you.